A very good morning to all of you. In today's session, we have Dr. Syed Imran, consultant orthopedic surgeon from Vikram Hospitals, Bangalore, a unit of Manipal Hospitals. Hello, doctor. And in today's discussion, we will be discussing everything about hip replacement surgery. So let's just start with our basic questions. So what exactly is a hip replacement surgery, and when should a person get their hip replacement done?
See, basically, before we come to a hip replacement, we need to know what exactly is a normal hip joint. A normal hip joint is a ball and socket joint.
Okay.
A ball and socket joint is basically, this is a normal hip bone,
Right.
pelvis bone, wherein it forms the socket. And then you have the ball, which is the femoral head. When we replace both the socket and the ball, it is called as a hip replacement. Now, when does it get damaged? It gets damaged, the hip joint gets damaged in cases of arthritis. It could be because of rheumatoid arthritis, ankylosing spondylitis. It could be because of an injury. When it gets completely damaged and the joint is very painful, we do a total hip replacement.
So when should a person consider hip replacement surgery, and what are the types of hip replacement surgeries?
A person should consider a hip replacement surgery when his hip joint is damaged because of arthritis, rheumatoid arthritis, ankylosing spondylitis. When these conditions happen to the hip, the patient has hip pain, which is limiting his walking, and there is something called stiff pain, night pain. The patient has difficulty in walking even without assistance. He's got decreased range of movement. This is a time when he should consider a hip replacement surgery. And when it comes to the type of implants that are there in the hip replacement, there are two types of surgeries available. One is an uncemented and a cemented. These are the uncemented hip implants. These are used without cement. This part of this is called as a femoral prosthesis. This goes into the thigh bone.
Okay.
And then, since it is a ball and socket joint, this goes into the acetabulum, which is the socket side.
Okay.
And in between you have a polyethylene liner.
Right.
And then you have a metal head.
Okay.
So this constitutes your complete hip replacement. So when you ask me what are the types of hip replacements, this metal head can be replaced with something known as a ceramic head. A ceramic head is more long lasting. We get a ceramic head, and then this liner can also be a ceramic liner, wherein we have a ceramic on ceramic articulation to make the hip even longer lasting.
Very interesting.
So these are the types of hip replacement. This is how a hip replacement would look like.
So doctor, tell us, how long does it take to walk normally after a hip replacement surgery, and are there any permanent restrictions?
Normally after a hip replacement, the patient starts walking the next day after the hip surgery. Initially when he starts walking, he uses a walker for support, and based on how his balance and his strength is, we gradually move over to a single stick in about 2 or 3 weeks, and then unaided by about 3 to 4 weeks. And coming to permanent restrictions, ideally the patient should not be squatting or sitting cross-legged. But now there is a newer generation of evolution of implants called dual mobility implants, wherein when a patient opts for these, he is able to squat and even sit cross-legged.
So what are the possible complications with hip replacement surgeries, and how do one avoid it?
The most common complications that happen after hip replacement surgery are infection. You can have a dislocation of the hip, and you can have blood clotting in your legs. And then the ways to prevent them is, how do we prevent an infection for a patient is, we optimize the patient even before surgery. Even before admitting the patient, we look at all the blood parameters, and we make sure he's ideally a fit candidate for the surgery. In case he's diabetic, we make sure his diabetes is well managed. In case he's overweight, we try to see if weight optimization can be done before the surgery. And coming to how do we prevent blood clots in the leg is, we start with early mobilization, and we keep him walking, and then we use some medications to prevent these blood clots.
So what is the duration of stay in the hospital post-surgery, and is there any planning that needs to be done at home?
Normally a patient stays in the hospital for about 3 or 4 days. Once the patient hits a particular milestone, that is the point of discharge. What are the milestone he needs to touch before discharge is, he should be able to independently walk out of the bed, walk to the washroom, he should be independently ambulant. This is the time for discharge. Generally it happens on day 3 or day 4. And then coming to the home planning after discharge, the basic requirement that I would require a patient to be done is a toilet seat elevation, and keep firm handrails around the washroom area, and whenever he's sitting, he should sit on a slightly higher chair initially, and a firm stool. These are the basic things that he needs to be done before discharge.
So doctor, tell us, how do we make the hip replacement surgery last longer?
To ensure a longevity of the hip replacement, what is required is the patient should maintain an ideal body weight, maintain a normal walking without abusing the hip, and doing regular exercises. He can ensure that his hip lasts really long.
So doctor, given the pandemic situations, are there any complications with the hip?
It has come to light that in post-COVID recovered patients, because of the steroid use, there can be an avascular necrosis of the hip. What exactly is avascular necrosis of the hip is basically the blood supply to the femur head gets cut off, and it leads to a slow damage and eventually death of the bone.
Okay.
It does not mean that every patient who has avascular necrosis needs a hip replacement. There are stages to it, which is the stages are based on MRI criteria and an X-ray criteria, and not everyone needs a hip replacement surgery, and there are ways to make sure the patients with avascular necrosis can delay a hip replacement surgery.